Welcome to the Dr. and Mrs. Curry podcast, where the emphasis is on parenting related matters. My name is Dr. Joshua John Curry, and with me is my better half, Mrs. Cartrisa Lynn Curry. Today's episode will concentrate on developmental milestones. We will focus on circumstances parents could find themselves engaged in that could hinder the collective accomplishment of developmental milestones experienced by their children, of course, from an all inclusive manner. We're going to jump right in with the subtopic of prenatal and perinatal appointment related involvement. One of the reasons why I wanted to lead off with this, throughout my career, I've worked with hundreds upon hundreds of very wonderful, very talented women who found themselves pregnant. And as far as matters, there were complications as far as their perspectives on being involved with prenatal and perinatal appointments. Everyone's different, whether we're talking about geographically, we're talking about socioeconomically, whatever's taking place. I've oftentimes found myself face to face with someone whom shared with me that even after discovering they were 4 weeks, 6 weeks, 8 weeks, 3 months, 4 months, in some cases, there have been a couple who've discovered they were pregnant a lot longer along the process. Of course, various physiological and biological situations have been taking place, but that's not relevant to the subject. What's relevant is we've discovered there's a pregnancy. So, of course, we want to make sure, with this being a parenting related podcast, we want to make sure that our children are as healthy as possible. Of course, if there are any concerns that medical practitioners could discover that could perhaps be alleviated, diminished in some manner, or whatever is applicable, we want to know these particular things. I've been told by countless women throughout my career, or even personally, when making inquiries about how are prenatal appointments going, and of course after birth, how are perinatal appointments going, and I will be told that this is something, I'm just paraphrasing collectively, I will be told that this is something that I do not believe in. And there are times in which, relatively recently, I'm working with I was working with a young woman. She was battling a history of abusing methamphetamine and other amphetamines. Also, in addition to that, she had a history of abusing central nervous system psychostimulants, which also included tobacco products slash cigarettes. She was also engaging in the abuse of synthetic and natural cannabinoids. So all of these matters were taking place. This woman and I, we've been working together for a very long time. So I had that rapport as far as our relationship, where I was just able to say in plain English, we're disregarding prenatal appointments, but also we're introducing our unborn child to these particular chemicals. So what I did, I sat back, I pointed that out to her and asked her, rather than the medications or the supplements or whatever takes place as far as doctors working with a pregnant woman, we're disregarding that, but we're still abusing based off what's being disclosed to me, based off of what's being presented or illustrated or substantiated by toxicological screenings that are taking place through the criminal justice system, with her being on county and state parole. What I'm asking here is, it's been substantiated through multiple avenues that we're engaging in the abuse of these chemicals. We're introducing these chemicals to the unborn child. And I didn't want to turn this into anything related to active addiction with symbiotism, other psychological considerations that corresponded with what's taking place. But we at least do have the decision. Now, going back to active addiction, so to speak, that perhaps may not be wholeheartedly in our control. I didn't want to focus on that. But what we are in control of and over is our involvement with prenatal appointments. But she would just share with me that she doesn't trust medical personnel. She wasn't able to, and I've been told this by multiple people across varying spectrums, different circumstances, geographically, and matters along those lines. I was told that there's a lack of trust from a medical standpoint. What I would do here, I would supply an intervention. I would say, let's lean upon individual psychology. Let's put ourselves in that room, that examination room, that medical office, whatever is applicable. We have we have two medical practitioners, one of which have, and of course, hypothetically, one of which has 26 years of just professional experience alone. The other has 20. So we're talking about 46 years of professional experience in the room alone. I would like to separate that from education. Let's just say hypothetically, they both have respectively 15 and 10 years of education alone, graduate level, postgraduate level education. So now we're talking about 25 years of additional education that I wanted to add that with the number I came up with as far as the hypothetical years of professional experience. What I do here, I'm putting someone in a position to realize that they are not in the hands of novices in most circumstances. They're with people who are relatively experienced, and I will talk about how, in various fields, how continuing education units is something that's mandated to maintain credentialing, maintain licensures, maintain certifications, board affiliations, and matters along those lines. I will talk about this being something that that I'm familiar with myself as far as being obligated by representatives from various boards to acquire X amount of hours of ongoing education over a very small period of time, whether that be one year or 2 years, just to remain abreast of contemporary correlations that's taking place in the respective field. But despite all of those efforts, from an individual psychological standpoint, to point out that you are in good hands, I would be told that as far as prenatal appointments, I stay away from them. As far as working with medical practitioners, I avoid them. I will see them when it's time to deliver. But then I'll dive into we're involved with chemical abuse. This is where I'll transition into studies show that contemporary scientific research studies have shown that we're abusing this chemical, that chemical, in addition to what our child could be exposed to from a genetic predispositioning standpoint. We're heightening the possibility of this particular child perhaps endorsing some sort of intellectual developmental disorder, some sort of psychiatric disorder, such as attention deficit hyperactivity disorder, with a combined presentation of impulsiveness slash hyperactivity, as well as inattentiveness. We're talking about potential physical ailments that could be either short term, long term, or permanent. We're talking about matters along those lines in which your child could develop, could be born small and remain small. We're talking about neurocognitive challenges in which or considerations in which your child's brain could be born smaller than what it's supposed to be. And that impact could have bearing on academic achievement, social involvement, as far as recreational activities with peers. This can make your child susceptible to varying illustrations of bullying and things along those lines. We can find your child experiencing matters in which they're not as successful or developing from a milestone standpoint at the same pace or near the same pace as their contemporaries. The child could fall behind. That could cause self-esteem related issues that could manifest themselves in psychological disorders. We could talk about that transitioning into your child presenting with conduct disorder, transitioning into antisocial personality disorder, which could ultimately find the child not managing criminogenic impulsiveness. Now we're talking about involvement with the criminal justice system that could perhaps be cascading or perpetuate itself. Now we're talking about years upon years spent in county jails, state and federal prisons. We're talking about someone who perhaps spent more time incarcerated or incapacitated in some manner, including substance abuse or mental health related hospitalization or rehabilitation, in comparison to the amount of time they spent on the streets. So, despite all of those efforts, this woman would still say, the woman that I just mentioned and others that I've worked with throughout my career, they will still say they are appreciative of the psychoeducation. And of course, I'm paraphrasing, but I'm still going to move on with my beliefs. This is something that I've done with my previous other 2, 3, 4, 5, 6 children, and they're totally fine. I'll dive into, we could think they're fine, but also going back to perinatal appointments. We were not involved with perinatal appointments. We have not been maintaining appropriate appointment scheduling with medical professionals as well. So there could be some undiagnosed complications that are presenting themselves that could potentially be amplified without sufficient diagnoses and treatment planning. But for some particular reason, I've worked with plenty of people, plenty of wonderful mothers who are just very afraid of working with medical practitioners, working along those lines, whether that be prenatal appointments, perinatal appointments, and we're still engaged in activities such as chemical abuse. And one thing that I've been working with a lot of people more more of is with third hand smoke. We're very familiar with first hand smoke, obviously, with smoking ourselves. We're familiarized as a society with secondhand smoke, with being around the presence of others who are smoking, how that can be hazardous as well. But something that I came across relatively recently that I've been utilizing and implementing professionally is third hand smoke. We're talking about you having X amount of cigarettes or Y amount of cigarettes earlier in the day. Those fumes, those toxins are still on us. We go home, we pick up our baby, we pick up our infant. They've been in daycare all day while we've been at work or doing whatever, doing something productive, taking care of appointments, running errands. We pick up our baby, we bring them close to us, we kiss them. All of those fumes are on us, are on our bodies. Our baby is, in a sense, breathing all of that in. All of those fumes are around the home. It's on the furniture. It's embedded into the walls. It's essentially it's circulating through the heating and ventilation system, air conditioning system. It's being breathed in 24 hours a day, 7 days a week. While we're in the home, it's being breathed in some manner from a third hand perspective. This is why I feel as though perinatal appointments are very essential. But still, and I point out all that stuff despite all of my preparations, and I present this in the best manner that I'm able to professionally from an intellectual standpoint to make certain that whomever I'm talking to, they understand where I'm going with this. But no matter what takes place, we're still very hesitant to become engaged in prenatal or perinatal appointments. And I bring everything back to the achievement of developmental milestones. And very oftentimes, someone whom I'm speaking to, in this case, will say a mother, she is convinced that their child is hitting the respective milestones and their child is on pace to move forward to continuing with achieving those respective milestones. From your standpoint, from Mrs. Curry's standpoint, what would you implement? What would you share with someone who's very hesitant as far as their involvement with prenatal or perinatal appointments, but they're still engaged in activities that could be hazardous to the child's overall development, such as chemical abuse?
And I think it's important for people to understand and realize like that prenatal appointments are not just the check of the box. Like they're there because doctors use that time that you come in to not necessarily they weigh you, which in and of itself is weighing your child to see that they're developing on time. They measure your belly to see that they're growing on time. And the vitamins that you take they have vitamins within them to help your child's brain grow, their lungs develop, to help every aspect of their body develop with the correct vitamins and nutrients that they need. So even though like someone says that they don't deal with doctors because of in a lot of cases it's an ingrained fear of them because of either something that happened when they were younger, or it's a generational fear that was passed down from a family member that had happened, like something happened to them when they were younger. So I would suggest like maybe reaching out to a nurse practitioner, someone that they are just as they're just as qualified, they have as many qualifications, they do as many certifications and testing, but they're just not considered a doctor, they're considered a nurse practitioner. They can still go over all the same situations and do all the same measurements for you, and maybe they won't be as intimidating to the person that needs to see them. And in some cases, they have nurse practitioners that will come to you instead of you going to them. So maybe talk to your insurance company, or maybe just even if you hear of someone that does that, just call them and see if they accept your insurance. So they're coming to you in an environment where you feel safer, and they will come to you, they will measure you, they will weigh you, and they'll talk to you about taking your vitamins and go over everything that you need to go over. So maybe think about doing it in that avenue.
When you and I were going over we were in our production meeting. We were making our preparations for this episode. I was looking forward to this episode, just like every other one. But for some particular reason, this one had stuck out to me just a little more in comparison to the ones we've done in the past. You made mentioning of, I wanted to cover this. You made mentioning of perhaps there's some concern, and this is something that slipped my mind when I was coming up with this and presenting it to you, and we were going through our production meeting. You spoke of there could be some concerns about if someone is perhaps still involved with chemical abuse from a toxicological standpoint. Would this be something? Of course, I've never been involved with prenatal appointments as a pregnant woman, with me not being a woman, of course, and perhaps never being pregnant. But to be serious for a second, you talked about I have no idea what's taking place in those rooms during or after, or perhaps even preceding, as far as from a toxicological standpoint. You made mentioning of there being concerns about with women, perhaps they're more worried about rather than, which I can understand, rather than placing the emphasis on the overall development of their unborn child and the health of their unborn child, there are concerns about what if this, whether it be a doctor, a medical doctor, a nurse practitioner, or any form of medical professional. You made mentioning of there being concerns about what if this medical professional, from a toxicological standpoint, realizes that the mother is abusing this chemical or that chemical, and they report this to Child Protective Services. Along those lines, as far as duty to warn, duty to protect, from a confidentiality standpoint, I am not wholeheartedly certain of at what point is a medical professional, in this case, obligated to report to Child Protective Services. As far as with the woman, in this case, we'll say hypothetically she's 5 months pregnant. So there's knowledge, she's growing, all of the physical signs are there. She's taking examinations as far as with urine. She's going through. She's gotten everything. She's going through confirmations through blood, so she knows she's pregnant there. But she's still engaged in chemical abuse and other activities that could be somewhat detrimental to the overall collective development of the child. You spoke of being reported to Child Protective Services, and of course, going through those proceedings are very anguishing. They could be, in a sense, traumatizing from a generational standpoint, particularly if there's a woman who's perhaps was involved with Child Protective Services herself, who've gone through this with previous children, perhaps may have had parental rights terminated outright, which I've seen, unfortunately, countless times throughout my career, in which parental rights of, we'll say, three children have been wholeheartedly terminated. Now the mother's pregnant, so now she's thinking, okay, rather than going through all of that psychological anguish again, if I can just keep things under wraps, so to speak. So in this case, we're talking about someone who is actively involved with chemical abuse. She's gone through Child Protective Services, or whatever the acronym pertains to from a jurisdictional standpoint. She was a part of Child Protective Services herself. She's either lost custody or had parental rights terminated, or had her children adopted out to either loved ones, whether closed or open. And that is something that we're going to discuss here later in this episode. So
Stop.
she's talking about I could be proactive in a sense here, that if I could just keep everything clandestine, if I could just go through this pregnancy and work through things essentially by myself time. She's worried about Child Protective Services, which in a sense supersedes what she has going on as far as prenatal slash perinatal appointments when applicable. What do we tell someone who's worried about Child Protective Services involvement while she's pregnant? And before you dive into your perspective, in this case, like I mentioned, she's roughly approximately 5 months pregnant. So of course the child is not going to be removed from her custody. Obviously, the child hasn't been born yet. So there is still time to get things turned around. So what do we tell someone who's worried about that at approximately 5 months pregnant, as far as disclosing what's taking place with her, or perhaps even just getting involved with prenatal services because of her being concerned about medical practitioners finding out that she's involved with from toxicological substantiation, that she's involved with chemical abuse, and perhaps reporting that to Child Protective Services?
I'm just being honest about it. Honestly, even if you don't go to your prenatal appointments, when you give birth, they're going to find out, because there are tests that are done that are mandatory, that are done when a child is born to determine their health, to see if there's anything else that the hospital needs to do, that if there's any emergency procedures that need to be done right away. There's testing that are done on children immediately as soon as they're born. Depending upon the state you live in, the county, and the area, that's going to depend upon what the testing is. And from my understanding from our two children, a lot of states, it's one of the ones that is automatically done is testing to see if there's foreign substances that shouldn't be in their system that are in their system. If the child tests positive for something that for an illegal substance that they're obviously too young to have done themselves because they were just born, it's understood medically and scientifically that they got that, they have received that into their system from the mother who just gave birth to them. So CPS, Child Protective Services, whatever affiliate that the state and the hospital reports to is automatically called. Now, each state, depending upon their procedures and how they do it, every state is different. Some states take the child automatically, and some just open a case and they start visiting you and start putting you through different programs and procedures so that way you can get healthy and make sure your baby is healthy and stays healthy. The thing with your prenatal appointment is it's so important and vital because the doctor can find out if there's something genetically wrong or if there's something that might be an abnormality within your child that can be addressed during developmental stages while you're still pregnant. Because there are certain procedures that doctors have available to them now that can help a child, that can help in a newborn before they're actually born. So they can help a fetus and a baby as they're growing and developing. Honestly, like as far as dealing with CPS, Child Protective Services, the best thing you can do for yourself and for your child's self is to do everything in your power to stop doing any illegal substance, because you're passing that on to your baby in your womb. And every hospital that, as far as I know, they test for substance, they test children. They have to test children when they're born for different things. And the hospitals that we've gone to, that's one of the tests that they do. So I can't speak for every hospital in America, but I believe almost all of them, if not all of them, do that.
Now, along those lines, the child's born. Of course, all of those examinations they've just materialized. So anything that's kept in the dark is now here. So everyone's known. We go through the notifications. But in this case, let's just say that the Child Protective Services caseworker, they're working with the mother, they're working with the family, they're making certain that treatment is happening. So this is one of the good caseworkers out there. So he or she is, they're about making certain that the mother and the family, they're transitioning into becoming the best versions of themselves to make certain that that child is in a position to be as successful as possible. So hypothetically, despite all of this, everything's taking place, all of those theoretical boxes are being checked as far as with family court. The mother, or perhaps in this case now, the father is involved, the father is engaged with decision making. So now the mother and the father, they've made decisions to not have involvement with perinatal appointments, including the child going through and as far as those follow-ups and things along those lines, they're not making those appointments. They're still like they're just going to do the bare minimum as far as getting through child protective services. So what they're doing here is rather than making certain that these appointments are taking place, if it's not mandated, if they're not obligated to do so, they're not doing so just because of beliefs as far as individualized, internalized, perhaps cross-generational beliefs from engaging with medical practitioners. So now we're talking about the main subject of this episode. We're talking about developmental milestones. So now they have no idea that this child is actually not meeting, from a projection standpoint, their developmental milestones. And this is something that I've seen professionally. Of course, I will I will state those concerns as respectful as possible while working towards maintaining the dignity of the mother or the father of the family. I'll make an inquiry. I've worked with I worked with a woman. She had a young child. This child perhaps should have been communicating, should have been articulating some sort of words, perhaps some small syllable words. This child was approaching the age of 4 years old and was unable to intellectualize, to articulate as far as utilizing words. So of course, every child is going to develop differently compared to the other. Some child or children may be able to say two, three, four syllable words, to may be able to actually formulate an actual question rather than utilizing noise or rather than just pointing towards something. And in this case, we're not talking about shyness. I made mentioning of perhaps, let's say, have we at least had any examinations done or screenings done for any form of intellectual developmental considerations, perhaps some form of autism and matters along those lines. And in this case, the mother would say, no, I have not done any of that. So I'll ask about, in comparison to other children in your family, either side of the family, where would you say your child is ranking developmentally? And please, of course, we love our children. We want our children to be the best of the best. But in this circumstance, I'm asking, let's be first honest with yourself. Be as honest with yourself as possible and be honest with me because this is just not to take care of an hour to get documented, but this is, we're working on collective well-being that could ultimately impact you. So as far as these perinatal appointments, it matters along these lines. What do we tell someone that's been shying away from any form of involvement? Now we're talking from a perinatal perspective with the child being born.
I think it's important, like, honestly, like if there's other children in your family and you notice that your child is not developing at the same rate or even close to the same rate that they did, I think it's important to go and see a professional. There are, or talk to their teacher. In some instances, there are programs that they're not doctors, but they are experienced and they're certified in testing children to determine what type of developmental delays or developmental issues they may have. So again, in that instance, there are programs where they will come to you and they will observe your child within their family environment. They'll observe them at school environment and they'll determine based on that and based on questionnaires with you as the family, different aspects and different things that could be going on. I think it's important though, as parents, to take our children to the doctor because the doctor is certified and they're intelligent and they know different avenues and different things that could be going on. And they may notice something that you as their parent may not notice. It's important to know how much they weigh, how tall they are. It's important to know these things because you may not necessarily realize it, but there could be, for instance, lead in the walls around your house. When you take your child into the doctor, there's a questionnaire that they give you and they ask, has there been any lead around? They'll test to see if there's lead in their system because the lead can cause developmental delays on top of other issues. So even though you may be nervous about seeing a doctor, one of the things I would recommend this for any parent that has this issue with taking their child to see a pediatrician or family practitioner. I personally would recommend a pediatrician for children. Take someone with you if it makes you feel more comfortable, like because then you'll have that backup person, that support person with you while you're sitting there, and it may help you feel a little more comfortable, a little more secure in taking your child to go see the pediatrician.
I like that perspective as far as taking someone with you, perhaps have someone else to ease off the attention. And there are some times we could just be a little shy. Maybe having that outgoing, extroverted person as far as us able to ask questions that perhaps weren't able to ask because of our own characteristics. I want to put a book up to the camera. This particular book here is the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. I want to bring it a little closer there. I utilize this book for an array of matters. It's been very instrumental as far as enhancing my knowledge of varying not just clinical diagnoses, but just personalities and behavioral traits. The reason why I wanted to show that book discusses an array of chemical use disorders, mental health disorders, personality disorders, intellectual developmental disorders. But one thing that is common that's repeated perhaps countless times throughout that text, it talks about varying symptoms presenting themselves in multiple contexts, multiple environments. So here's where I'm going. I made mentioning to someone about the woman that I was just talking about her child being at an age in which during our times together, and I was fortunate enough to be around this child once a week for an hour during our individual sessions rather than putting the child in a daycare center, which of course totally her choice to make. She would always ask if her child could come into my office No problem there. Whatever's comfortable for you. I want you to be comfortable. So our individual counseling session could be as productive as possible. But one thing there is I would make mentioning of I've been around your child for 8 sessions, spanning 8 weeks, spanning north of 8 hours. I've not heard your child say one word or come close to saying one word during this time period together. So the mother would say, well, she's shy around you. So what I'll ask there say, okay, that's fine. That could be that could be realistic. That could be possible. So now we're talking about, okay, is this behavior? So she's only quiet. Is she only quiet here? How is she at home? How is she at grandmother's house? How is she at auntie's uncle's house? How is she with daycare? Is it the same there? So in that case, she's now thinking. And she would say, yes. So what I'm talking about there is the symptomatology is replicated in multiple environments. So my environment here in my office has no bearing or is not applicable to you being at home, school, grandparents' homes, homes of relatives. So these behaviors are still taking place from a developmental standpoint. So what I'm doing here is I'm trying to provide that encouragement to at least seek medical attention. I just wanted to point that out before we transition into our next subject, just to remind our audience that this particular platform was created to just have an avenue of parenting related considerations from an all inclusive, non judgmental perspective. There is a concept that takes place internationally from a phenomenological standpoint that's referred to as adoption. It may not be something that's wholeheartedly excited or comfortable to discuss, but this particular platform, I at least wanted to bring awareness of the positive side of adoption. What we're talking about here is someone created a life through a course intercourse. Matters took place, whether it was something that was known immediately or perhaps a couple of weeks, a few months, or even a couple of years after the child is born. The situation, we came to the realization that this isn't something that perhaps I want to do or I perhaps should do at this point in my life. Maybe this could be different later on. But as far as what's best for the child, we're talking here is perhaps adoption is something I should look into. So let's just say in this case, the mother discusses it with her center of influence, perhaps even with the father of the child. Hopefully, he is around or at least involved in some manner. So the decision is made that for the best interest of this child, to make certain that this child has at least a heightened opportunity to live a productive, fruitful, constructive, happy life. Perhaps I should reach out to an adoption organization and have those arrangements to be made for my child to be placed with a family that perhaps, at least as of now, is in a position to uh, to be involved and care for my child much more better than what I'm able to right now. So what we're talking about there is these decisions have been made. So now what's taking place, there's a level of compartmentalization. The mother was able to put in the back of her mind that this did happen, but now things are going through, now she's going through a decompartmentalization process. So now what took place, everything's already done, it's been finalized. The child is now engaged with their adoptive family, but now this mother is struggling from an emotional standpoint because of what took place. What could we offer someone who's going through that? Because now they made the decision, they were honest with themselves that their child would be better off in the custody or adopted out. But now they're going through, they're pretty much having that remorse, so to speak. So now this is troubling them. Now they're worried about their own self esteem as far as parenting in the future. What would you offer someone who's going through that process, but now they're battling internally from an emotional standpoint?
I would say in this instance, I honestly think that seeking a little bit of guidance and counseling would be good. But also remember the reason why you made the decision you made. You know, it's not a decision that you took lightly. It's not a decision that you made just off the whim. It's a decision you sat down, you weighed the pros and cons, and you decided that this was the best avenue for you, for the baby, for everyone involved. So just remember that this wasn't a knee jerk decision. This was a well thought out decision. This was something that you put a lot of time and consideration into. And there was a reason why you made that decision. You know, just because you decided to give this baby up for adoption doesn't It does not mean anything towards when you're ready to be a parent and you decide to be a parent. It doesn't affect that decision at all. It doesn't trickle down the line as far as saying, well, you gave one baby up so you can never have another one and you can never be a parent. That's not how it works. And that's not true. So I would honestly recommend seeking counseling so that way you are still comfortable with the decision you made. And that way you also have an avenue of someone that is educated and licensed to talk to, that's not going to give you they'll give you their opinion, but it'll be an educated opinion. They're not going to say negative things about you or make you feel worse about yourself, even if it is done unintentionally. Like someone that's not skilled in talking someone through something like this could do that unintentionally. But the most important thing is to remember that it's okay to go through adoption. It's okay to let your baby be adopted if you feel like you're not ready yet. There's nothing wrong with that.
Working in the field for throughout my career, I've had these discussions on an array of circumstances, on an array of throughout my career, just on countless times. And I've had those discussions. I always tell people, whether it was with companies that allowed me the privilege of working for them, or with our own company, Dr. Curry and Associates, through our family court clinical advocacy program. That's something that I look forward to doing. I feel as though that's something I'm passionate about, and we're able as a company to do a great job as far as clinical representation. But whether through teleconferencing, through telehealth, whether in person or whatever's taking place, I've oftentimes asked someone and said, we're honest with ourselves. Is adoption the right option? Is that what's best for the child? Are we being selfish if we were to keep the child with us? And here's where I'm going. I always tell everyone, I will support whatever you want to do. If this is what you want to do, I will dive in wholeheartedly, support that decision. If we're shifting here to this end of the spectrum, if that's what you want to do, I will wholeheartedly support you there. But either way, myself and our organization, we will be there, Dr. Curry and Associates. We will be there to help you get through what you're going through. I wanted to toss you a hypothetical case consultation related situation. We have a woman, very nice, very sweet. She's given birth to 5 children. She's given birth to 5 children from 5 different men. Her first 4 children, they've all been adopted out. She's lost parental rights. This woman is only in her early 30s, so she's still well within that range of childbearing years. So, like I mentioned, she's had parental rights terminated from her first 4 children. She's never had any assistance from either of the fathers of either of those 4 children. Same situation currently with her fifth child, her youngest child that she's given birth to. This child is on the verge, and we're talking hypothetically, but I'm sure there's someone in our audience who could relate to this in some manner, whether that be indirectly or directly themselves. This is why I wanted to use this platform to at least give someone some sort of perspective that they could at least rattle with in the noggin. This person with the fifth child, she is on the verge of having this child adopted out too. This individual is currently psychiatrically hospitalized. The criminal justice system just came to a realization of where they're at. I'm not certain if her confidentiality was violated, but that's irrelevant to the point I'm making. She's facing she has active arrest warrants across multiple counties across various states. She is looking to serve at least 2 years, either in county jail or state prison. I'm not sure how that's going to work out, but there are some trial proceedings, and she did share with me that she's not very optimistic about how this is going to go since they've now realized where she's at. So, upon being released from psychiatric hospitalization, she will be turned over to the criminal justice system to face these criminal charges and perhaps even incarceration. So, she's already on the verge of having this child adopted out, perhaps even losing her parental rights because, fortunately, there isn't family or friends who are able to assist her. Speaking of which, in addition to not having any support from the biological father of this child, she doesn't have any pro social family members or friends who could assist her. So she is literally on her own. She's leaving the psychiatric hospitalization, and she has co-occurring mental health and substance abuse related issues that she's going to still struggle with. She perhaps is facing incarceration for the next year or two. Besides that, there's street homelessness. She doesn't have unfortunately any means of pro-social legal income to support herself to maintain a roof for her and her child. So besides that, transportation is an issue. She has gone, based on what she disclosed to me. There were periods of time throughout our time working together. She has gone days without eating. So, and that also included times in which she said this was something that she's grown accustomed to. This was part of what led to her having her parental rights terminated as far as her first four children, and this is something that's been taking place with her current child, who is barely a toddler themselves. She spoke about going days with just feeding her child snacks. She could either shoplift from the store and also providing her child with water from the water faucets in her bathroom, in her home, in her bathroom and sink, just to survive. So we're talking all this lack of employment history, no real marketability, no real vocational skills that can be used, and that can change, of course. Unfortunately, no formal education with her no longer attending school at, before completing middle school. So that's an issue there too. No essential skills as far as vocationally where she could be marketable to land some sort of employment. So with all that taking place with her, I've asked her, as far as your child remaining in your custody from your perspective, being honest with yourself, and then being honest with me, is this everything I've just said, which is tangible, which is of course her life? I will share with her, is this what's best for your child from a safety consideration? And also the affiliates that she does associate with, they're antisocial, they're involved with criminogenic behavior, activities, which of course attracts the wrong crowds. Now there's safety and safeguarding related considerations. So we have all of that. And she is still saying, yes, I want to fight for this child. I love my child. I love my children. And I will share with her, I'm pretty sure unconditionally you do. But unfortunately, we have not been in a situation in which your child has been safe. And through the level of rapport that we've developed over the course of the time we worked together, I'm comfortable with speaking openly and honestly from my perspective as far as what I've experienced, what I've seen with her. So she's allowed me to work with her. I'm comfortable enough to say that without having her shut down. I'm confident that I'm able to present matters in that way in which she understands that, of course, it's all coming from advocacy and support. It's all coming from a non-judgmental standpoint that I'm just asking for her to share with me her viewpoints on things so adjustments could be made as far as advocacy and support. But essentially, she would share that I feel as though that despite all of that, I can still be the best mother possible for my child. So with all that I've thrown at you, what would you offer her as far as with everything from psychiatric hospitalization, with her knowing that she will be at least transported to some jail somewhere, whether it be in this state, one of our neighboring states, she could be potentially facing time in state prison, depending upon how things go for her as far as her criminal proceedings, not having any significant education or employment prospects, not having any certainty, even if she doesn't get incarcerated, not having any certainty of where she's going to lay her head at once psychiatric hospitalization comes to an end. So, despite all of that, her still feeling as though she still wants to move forward with sustaining custody of her child and not having her parental rights terminated with her child being adopted. With all of that, what would you offer her from a supportive standpoint, from an educational standpoint, from an informational perspective?
Someone in her situation, I think it would be best for her to the people or person that currently has guardianship of her child, and I'm going to just assume that they're the ones that would be adopting the child once the rights were terminated. I would recommend working out a relationship with them and working out an agreement with them that, because just being honest, the state's going to move forward with termination. She doesn't have anything that would substantiate being able to raise a child currently. So they're going to move forward with their next steps. I would recommend that she work with the people or the person that's going to adopt her child and sit with them and talk to them, explain to them, hey, I know I'm a little down right now. I'm a little down on my luck, but I would still like to be present in my child's life. I would still like to be able to come see her, visit, do these different things, still be around. Just make it, I would recommend talking to them and maybe making it to where it would be like a co-parenting relationship in a way, where obviously she would need to be respectful of their wants and their needs, and because that would be representative of the child's wants and needs. But if they can work out an agreement and work something out, she can still be present in her child's life. there's there's no one way of adoption. Adoption is not just it's not just, well, my rights are gone and I can never see the child again. There are many different types of adoptions, and each one can be different. Each one can be worked out between the parties to where it fits for everybody. So I would recommend that she do that. And then maybe to make it a little more legal, make her feel a little safer, get a mediator and get the agreement notarized and put it on file so that way she has a legal recourse if something goes wrong. But I think the best avenue for her would be to sit down and discuss this with them.
I feel as though that perspective would be very advantageous for anyone in that situation. But I wanted to throw you a curveball, so to speak. With this particular hypothetical circumstance, the adoptive family is either living across the country, where now we're talking about logistical challenges that perhaps may not be realistic, or this adoptive family has already made arrangements to relocate. They've already transferred, as far as professionally, they've already transferred to within that conglomerate as far as where they're going to the other side of the state. And we're talking about not a realistic car ride on a Friday evening after a long week of work. We're talking about airplanes being needed. We're talking about travel arrangements, hotels are now being needed. So this is a concern, hypothetically, that this particular person could have. So in this type of situation, so the only form of realistic communication would be, in this sense, through through technological means, as far as the face-to-face interaction, as far as that physical hug, that physical kiss, and all of those matters that, of course, we enjoy, that we're privileged, that we've been blessed to as parents. This person has accepted, embraced the realization that that will no longer they will not have the logistical means to even take part in that. So this could be something that's concerning there. So under those circumstances, if matters are moved towards, what will we tell someone knowing that their relationship with their child, biological child, will predominantly be through these means moving forward?
I would still say and recommend the same thing, because even though you're not going to be able to put hands on them or anything like that, a strong relationship and bond can still be formed through this means of communication, through telecommunication, through phone calls, through videos, through those types of things. But within that type of situation, again, even with the situation, if they were staying within the same area as the parent, consistency would need to be primary. So if you guys made arrangements to talk every Tuesday and Thursday at a specific time, you need to make sure you're on that phone on Tuesday or Thursday, or you're on that phone, you're in front of the computer, you're wherever you're supposed to be at that time, so that you could still have and create that relationship and bond with your child. I still say, like, obviously sit down with them, discuss it with them, because there's nothing that can't be worked out. Like, if all parties are in agreement to it, you just have to remain consistent with your part of it, though. So there are parents that, unfortunately, they weren't able to stay together. So dad lives in another state than mom and the child, and they still have good relationships and good bonds with their kids because they put in that work and they put in that effort through phone calls, through videos, through conference calls like this, over the phone, over the computer. Then they go visit when they can, or they bring their child to visit them. Just because right now you're down on your luck doesn't necessarily mean in a year from now you won't be able to go visit if you keep up that communication.
With this particular episode focusing on developmental milestones and achievements and matters along those lines, I'm also including the manifestation of self-confidence, self-assurance, keyword or prefix being self. I've worked with people in these types of situations where we've, at least one on one, we've said to ourselves, that actually is most appropriate as of now. That's what's most suitable for the well being of my biological child. But what will be shared back, either in this secure setting or when in an office face to face with the door closed with noise cancellation machines going off, the individual will share with me that they are worried about good old social media. They are worried about people who are irrelevant to them. I'm not saying that anyone's irrelevant, but they are irrelevant to them. They are concerned about former high school classmates whom they had no interaction with during the past decade. They're worried about what will that person post about me agreeing to an adoption. Will we tell someone who's easily perhaps influenced or easily impacted by whether it be 140 characters through Twitter or some other means, perhaps even a YouTube video? What will we tell someone who could perhaps go through some form of emotional imbalancing, some form of decompartmentalization, some form of psychiatric dysregulation because of the posting or response or video of someone who is perhaps irrelevant towards them, someone who had no involvement with the child whatsoever, someone who's not engaged with the adoption proceedings, but this person's opinion is so powerful, it's so influential that it's triggering or inducing emotional imbalancing, psychiatric dysregulation, and things along those lines.
In that instance, I would say it's important to realize that social media it's just an avenue for people to stay in contact with their friends or associates from years ago. It's important to realize and remember that your life is your life. Nobody knows the ins and outs and everyday activities of your life. And if you want to sit down and think about it, what does that person that's making that negative comment even have going on in their life that's what they think of yours? It's important to realize that everyone has an opinion, and the people that everyone's opinion is not always good, but it's important to know that your opinion about yourself and your opinion of your situation is the most important one, and that's the one that matters. You have to tune out other people, because as sad as it is, other people don't care about you. They may smile in your face and say that they do, but the true reality of it is, unless they're a loved one and someone that you've been in a relation, like you've known for years and years and have always been there for you through the ups and the downs, they don't care about you. They're just trying to make their opinion about something that they don't know about known, because in some instances they're bored with their own life. But it's important to realize and understand that they don't know you. They don't know the ins and outs of your day-to-day life. They don't know what's going on in any aspect of anything. So if you stay on social media and you like social media, block the person, drop them, don't follow them. So that way you don't have to worry about it. One of the things about social media is that you can block someone, you can put them on hold. There's different avenues to make it to where their opinions you don't see them. So maybe go through that avenue and do that, so that you're not influenced by what they think they know.
In addition to everything that you just shared, all that wonderful advice, I've had people, believe it or not, tell me that they've went through all those proceedings, blocked and things along those lines. They still purposely navigated through, tracked down this person who's irrelevant to them to see what are they saying behind my back in a sense. So I would ask, are we this person isn't endorsing features of some sort of personality disorder such as histrionic or matters along those lines where they're not seeking attention, but they're still purposely going through and worried about what someone's saying behind their back in a sense. So I'm asking, why is that relevant? And we're talking along the lines of adoption, involvement with child protective services, and things like that. And I would ask the person, why are we intentionally looking? We've already blocked this person. We've changed our account. You're looking for what this person's saying behind you. Like you just mentioned, they're they have no intimate knowledge of what's taking place as far as these proceedings. We've decided that this is what's best for your child from a developmental perspective to move forward and live that productive, enriching, fruitful life. But we're still worried about the opinions of others. That's causing us to have, again, that emotional balance, psychological dysregulation, and now our decision making is impacted a variety of reasons, but also one of those reasons being the opinions of those who essentially are irrelevant towards us, our loved ones, and what we have going on from a familial dynamic perspective. I wanted to shift direction, so to speak, remaining along the lines of developmental milestones and corresponding accomplishments and achievements. I wanted to talk about, we're going to address children who are a little bit older, but still going through various stages of development. I want to give a hypothetical situation. We're talking about a 13-year-old girl dating a 22-year-old male. So what happened here was, once upon a time, this 13-year-old girl, during this period, she's in the 8th grade, about to reach her 14th birthday, similar to our daughter. Along these lines, at that time in her life, this person shared with me, this person shares that they were perfect students, perfect grade point averages. They were involved with various sports, various forms of extracurricular activities. These achievements led to her experiencing a level of autonomousness as far as with her parents. Her parents felt as though she was mature enough with everything she was able to do. So this young lady did, stars got aligned in which she was able to meet this 22-year-old male who put her in a position to, who introduced her to sexual intercourse, got her pregnant. And of course, we're not, we can't ignore statutory rape related considerations. So crime victimization, we're talking about child endangerment. In addition to that, this person introduced this 13-year-old girl who has not reached her 14th birthday yet to the abuse of various alkaloids as far as cocaine. We're talking about the introduction of the abuse of methamphetamine, various forms of alcohol, natural and synthetic cannabinoids. So, of course, with all of that taking place in her life and also being pregnant, matters go down. Those achievements turn to anguish. Parents are trying to pick up the pieces, wondering what happened, wondering how did my 13-year-old daughter, who was doing all of this, get involved with a 22-year-old male? What's going on in the life of this male? What makes him even feel as though there's anything to even talk about to a 13-year-old who's not your loved one, as far as a stranger? How was that initial interaction? What was that initial dialogue like? What did they discuss? What did they do? But either way, now development is tainted because now this family is Catholic. So of course, abortion isn't an option. The child will go through prenatal appointments and matters along those lines. Make sure the kid is healthy as possible. The child will be born. So now we have a 14-year-old mother. Now we have all these other concerns. Now the mother is going through active addiction and co-occurring mental health challenges. The 22-year-old is now 23. Unfortunately, matters take place as far as the criminal justice system. This person is now incarcerated and will be serving at least 12 years in state prison. So from a developmental standpoint, will we offer parents, as far as regardless of how mature our children may present, and they are, as far as maintaining sufficient grades, being successful academically, being very, very social, as far as having circles of friends from various avenues, from this school, from that activity, from church, from the neighborhood. So things are looking very optimistic. How do we keep parents involved? What do we offer parents to make sure that they don't put those blockers up as far as becoming blind to what's taking place in the life of our children as they going through those developmental milestones and accomplishments, to make sure that that transition into late childhood / early adulthood is positive, it is pro-social, is constructive.
I would say it's important to always check in with your kids. Like not do it like a weekly thing or a monthly thing. Every single day you should be talking to your child. So the drive to or from school, the drive to or from an activity, take a walk around make them go with you just for a simple walk around the block or something like that. It's important to keep that interaction going, because then you'll know and you'll notice different changes that may be occurring. So it's important to keep open communication and to stay in constant contact with your kids, because when something like that happens, you'll know earlier, you'll know sooner, to where you could possibly prevent some of it from happening. And then in that instance where she's a teenager and she got pregnant, every person is different, but I believe adoption, there's nothing wrong with it. And like I said, there's multiple different types of it. You can sit down and work out contracts between the parties to where where it works for everybody involved. In her instance, in her age, I would recommend it because now, yes, she did have a child, but now she's not going to be a teen parent trying to raise a child and continue to grow and develop herself. So it's not going to hinder her development in other avenues and other ways. But as parents, I think the biggest thing to do and the biggest thing that we have to do as parents is to stay in constant contact and know what's going on with our kids.
I do think that's a very terrific way to bring this episode to an end. This will conclude this episode of the Dr. and Mrs. Curry podcast. Mrs. Curry and I genuinely hope that you found the information informative and that either you or someone you know could benefit from this platform. If so, think about liking and sharing this presentation, sharing this episode. If you have not already done so, consider subscribing to our YouTube channel, which is Dr. Joshua John Curry, ED.D, and hit that notification bell so you could be notified when videos and presentations have been uploaded. In addition to our parenting related podcast, there is a chemical dependency related relapse prevention podcast and multi-systemic presentations that our organization put together and upload to YouTube. Whenever you have time, visit our website, which is www.drcurryandassociates.com, which will connect you to our company, Dr. Curry and Associates. Look into viewing and following us on Twitter. Our Twitter handle is at Dr. Joshua Curry. Thank you again for taking part in this episode, and we will catch you the next time around.